You know what the most common question I hear is, how long is this treatment going to take? And when you're dealing with spine pain, every single day feels like forever, right? So let me share something that might give you hope and realistic expectations about your journey to recovery. Spinal decompression is designed to relieve pressure on compressed nerves in your spine, and it might help with conditions like herniated discs, spinal stenosis, and sciatica. But here's what's fascinating about non-surgical spinal decompression. It uses specialized equipment to gently stretch your spine, potentially creating negative pressure within your discs. So, the idea is that this might allow herniated material to retract and improve nutrient flow to damaged tissues. By the way, the remarkable success of this therapy is not determined by the treatment alone, but mainly hinges entirely on a crucial partnership forged between a patient who is correctly identified as what I call an ideal candidate, and an intelligent practitioner whose refined skills and absolute expertise in the spinal mechanics, which makes all the difference in the world. So now let's talk about what you might actually experience. During your first week or two, you might feel some relief during or right after sessions, but don't get too excited yet because it's often temporary. Your spine is just starting to adapt, and sometimes inflammation actually increases before it gets better, around weeks 2 to 4. This is where most people begin noticing meaningful improvement. Many appropriate candidates experience some level of pain reduction during this period. Your discs might start showing improved hydration, which is basically your spine saying, okay, I think I'm starting to get this. Weeks 4 to 8, this is typically when significant improvement happens. If you're going to respond well to non-surgical decompression, you'll usually show clear improvement by around the 6th week. This phase is all about stabilizing those gains and strengthening the muscles that support your spine. The final phase, weeks 8 to 12, emphasizes long-term stability. You'll often transition to exercise-based therapy and lifestyle changes. Maximum improvement from non-surgical decompression typically happens by 10 to 12 weeks. What affects your timeline? Age matters, interest, and why younger people typically recover faster. Your overall health, including your cardiovascular fitness and whether you have conditions like diabetes, influences how quickly you heal. If you've had symptoms for a long time, your nerves often need more time to recover. The severity of nerve compression affects timeline expectations too. Mild compression typically resolves faster than severe, long-standing compression. That is intuitive and makes perfect sense, correct? So, for non-surgical treatment, how well you stick to the protocol significantly impacts your outcomes. Let's talk about different conditions. Again, these are just guides. I've been doing this therapy for decades, and there are variations. Each case is different. Saying all that, let me give you a guide with herniated disc sufferers. Non-surgical decompression might show improvement in many appropriate candidates within 6 to 8 weeks. Spinal stenosis typically requires longer treatment periods, and non-surgical approaches may take 8 to 12 weeks to show maximum benefit. Sciatica symptoms often respond well to successful decompression, with non-surgical treatment potentially providing relief within 4 to 6 weeks. Research suggests that non-surgical spinal decompression shows positive results in many appropriately selected patients. Here's what I want you to remember. You can generally expect initial improvements within 2 to 4 weeks for non-surgical treatment, with maximum benefit typically occurring by 8 to 12 weeks. But listen, individual experiences vary significantly, and you need to maintain realistic expectations while working closely with your healthcare team throughout the process. I know it's frustrating not having exact timelines, but your spine didn't get this way overnight, and healing takes time. The key is finding the right approach for your specific situation and giving it the time it needs to work. Remember, this information is educational and should not replace professional medical advice.